vaccine as well.
Okay, Delegate Solomon.
Thank you, Mr. Chair. A lot of my questions have been asked already. I would just associate my comments with certainly Delegate Resnick's. I posted, what my constituents wanted to hear on Facebook this morning or yesterday. And the number one issue was a unified system. WBUR had a story about a software engineer in Massachusetts that designed a system that at least allowed the appointments to be aggregated. So I would strongly encourage you to figure out some way to streamline it. My question is a quick one. I know in the letter that we wrote, we asked any update on getting a mass vaccination site for Montgomery County, since we're the most populous jurisdiction in the state?
So we're happy to discuss that with the county. We continue to make sure that, that it's really about doses right now as well, to make sure that, if we open up additional sites, that there's some geographic spread, but also looking at how we can ensure that we can have enough vaccines for additional sites.
So then maybe this is a follow-up that I should have asked to begin with. What was the decision? How was the decision reached to place the other vaccination sites, again, when Montgomery County has the largest population by far in the state, and we were left out of the original batch
of vaccine? So as I said, in Six Flags, again, the infrastructure was already there because the tents, the setup, I don't know if you've actually been to the site, but we had set that up back in the summer for testing. And so the infrastructure and much of the staff was already available. And so that was one of the reasons why we were able to pivot and quickly put that site together.
And what about the other 5? How come Montgomery County couldn't have stood something up that quickly? That seems a little bit, and I see by Dr. Gale's face, I mean, it seems to me like if the commitment had been made to Montgomery County, again, 1.1 million people in the state, a sixth of the entire state population, if there had been a commitment to the county, we could have easily had a site set up. That seems crazy to me, but I appreciate your comment.
Okay, first